Universidad de Isabel de Naga Incorporated, our well-being matters. Whether it's a simple headache before an exam or a sudden dizzy spell, the University Clinic is here to help.
That's right. From simple headaches to more serious complaints like shortness of breath, it's all part of our learning experience.
Welcome! We're just about to start prepping for today's awareness session. Hi, good morning everyone. Welcome to University Clinic, and today we're going...
Here at the University Clinic, student health is our top priority. Every day, dozens of students visit seeking help for common yet important health issues.
Today, we'll take you on a quick yet helpful tour of the top 10 most common health concerns encountered here at the University Clinic so that you know what to do when they happen.
Headaches are one of the most common health concerns among college students. They can be triggered by stress, dehydration, prolonged screen time, hunger, or lack of sleep. When headache strikes, pause and give yourself a break. Rest your eyes, hydrate with water, and find a quiet place to relax. Inhaling mentholated oils or balms like white flower may help soothe the pain. Gentle temple massage and deep breathing can also bring relief. If possible, take a short nap or lie down in a dark, quiet room. But if the headache persists, recurs frequently, or worsens, don't hesitate to visit the University Clinic for proper assessment and care.
Coughs and colds are common viral infections that spreads easily through droplets, especially in crowded areas like classrooms and dormitories. They're often caused by sudden weather changes, close contact with infected individuals, and a weakened immune system. If you are feeling under the weather, practice good respiratory hygiene. Cover your mouth with a tissue or your elbow when coughing or sneezing, and dispose of used tissues properly. Stay hydrated with warm fluids, get plenty of rest, and consider using an antibacterial gargle like Bactidol to help reduce throat discomfort and prevent secondary infections.
Dysmenorrhea or menstrual cramps is common among adolescent and adult females and is caused by uterine contractions and hormonal changes. To relieve discomfort, apply a warm or hot compress to the lower abdomen, take analgesics like ibuprofen, try light physical activity or gentle stretching, and get adequate bed rest. If the pain is severe, visit the clinic for further assessment.
Difficulty of breathing or shortness of breath can be alarming and may stem from various causes such as asthma, allergies, anxiety, or even physical overexertion. At the first sign of discomfort, stop any activity immediately and sit upright to allow better lung expansion. Focus on slow, deep breaths to stay calm. For some, using a prescribed inhaler or reliever medication may be necessary. If you suspect it's allergy-related, move away from triggers such as dust or strong scents. For anxiety-induced episodes, controlled breathing techniques and guided relaxation can be helpful. But if symptoms don't improve or worsen rapidly, seek immediate medical care at the clinic.
Vomiting can be triggered by various factors. It includes food poisoning, gastrointestinal infections, motion sickness, or even stress. It is the body's way of expelling something harmful, but it can also lead to dehydration if not managed properly. After vomiting, it is important to rest quietly and allow your stomach to settle. Avoid solid food temporarily and instead sip clear fluid slowly like water, oral rehydration solution, or electrolyte-rich drinks to replace lost fluids. Abdominal pain can result from a variety of causes such as indigestion, gastritis, constipation, or even gastrointestinal infections. When pain strikes, stop any activity and take time to rest, as physical movement can worsen discomfort. Try to recall and track what you recently ate and avoid common irritants like spicy food, caffeine, or carbonated drinks. If pain is persistent, sharp, and comes with other symptoms like fever, vomiting, or diarrhea, it is important to seek immediate care at the clinic for proper evaluation and treatment.
Toothaches can be caused by dental cavities, gum infections, impacted teeth, or even sinus issues. The pain can range from dull and throbbing to sharp and intense. To ease the discomfort, avoid cold, sweet, or hard foods that can trigger or worsen the pain. Applying a cold compress on the cheek near the painful tooth may also relieve the swelling. It's important to maintain good oral hygiene by brushing gently, flossing to remove food debris, and avoiding sugary snacks.
Fever is the body's natural defense mechanism, a signal that it is fighting off an infection. It can result from common illnesses like flu, bacterial or viral infection, or even overexposure to heat. Regularly monitor your temperature, ideally every 4 hours, to track any changes. To help reduce fever, you can use interventions like tepid sponge bath, applying cool water to the neck, armpits, and groin area. Cool fever patches or cold compresses on the forehead may also provide temporary relief.
Wounds can happen unexpectedly, whether from a small accident, a fall, or even during physical activities. No matter how minor it seems, it's important to treat wounds properly to prevent infection. Start by gently cleaning the area with the clean running water to remove dirt and debris. Then, apply an antiseptic solution like povidone iodine or hydrogen peroxide to disinfect the wound. Once clean, cover it with a sterile bandage or dressing to protect it from bacteria and further injury. Dizziness is a common sensation that can feel like lightheadedness, unsteadiness, or the room spinning. It can be caused by fatigue, low blood sugar, dehydration, anemia, or even sudden changes in position. At the first sign of dizziness, sit or lie down immediately to prevent falls or injury. Close your eyes and rest, and if possible, elevate your legs slightly to improve blood flow to the brain. Hydrate with water or electrolyte drinks, and if you haven't eaten in a while, try a small snack to raise your blood sugar. If dizziness is recurrent, visit the clinic promptly to determine the underlying cause and get appropriate care.
Those were the 10 most common health concerns that you shouldn't ignore, and we hope you learned something helpful today.
Don't forget, the clinic is open for everyone. Students, staff, and guests. When in doubt, seek help. Your health matters.
Stay aware.
Stay prepared.
Clinic 101's got you cared.